Hello, my name is Vincenzo Petrucciello, and I am here today to report to you live from the streets of East of England. Now, great things are happening in hospitals all across the region, things that will improve the experience of patients with learning disabilities and of course autism forever. Now you may well ask, what are these things? Well, they are called reasonable adjustments because they are always reasonable, and they are an adjustment to the way things are always usually done. Now, let me pass you over to Dermot O'Riordan, who is the chair of the East of England Senate, who will fill you all in on why reasonable adjustments are always necessary.
So why do we need to make reasonable adjustments? Sadly, over the last 10 years, a number of national reports have consistently found that people with learning disabilities and autism experience poor quality healthcare, and this results in poor health outcomes, and this is true in both primary and in secondary care. And what do we mean by reasonable adjustments? Under English law, reasonable adjustments are changes in the way that we deliver care so that people with learning disabilities and any other protected characteristic as defined by the Equalities Act, which means that they experience the same high quality healthcare. It's also worth remembering that the way that we deliver services, sometimes for people with learning disabilities, may need to be very different so that they can achieve that same high quality outcome.
The Hospital Communications book can be used to support you in having conversations with people who have difficulties understanding or communicating. It contains useful tips and pictures to aid communication.
Chief Nursing Officer for England. I'm really pleased to have this opportunity to speak to you and support the work you're doing on reasonable adjustments. This is such a priority and so important for those patients who have a learning disability and who need access to care in acute settings. Since April, I've been the lead for learning disability at NHS England, and that has really opened my eyes to some of the difficulties that the people we care for face. So it can often be relatively simple things like somebody understanding when a patient with a learning disability is going to come into hospital, making sure that they have time, that they have space, that they have the ability to be able to share with you what's important to them and how they can be best helped within an acute setting. The work you've done on Everything Helps, It Helps is fantastic. Having 5 straightforward and simple things that can be implemented consistently every time somebody with a learning disability comes into one of your hospitals has got to be worth pursuing, has got to be worth implementing. As I said, I've had experiences described to me in detail by people with learning disability whose relatives and carers have not been listened to, who have not been able to have loved ones with them in hospital, and who have not understood some of the things that have been done to them. So being able to give people early appointments, for example, slightly longer, to enable those individuals to have time spent with them to ensure that they understand what's happening. And what may be quite a simple thing to you or I is so important to those people with a learning disability. Enabling them to have equal access, to be cared for in a way that is meaningful to them, and to allow them to recover as quickly as possible from a visit to a hospital or an inpatient stay is absolutely vital. I am so pleased that you've done this work across the east of England. I hope it can be rolled out nationally, and I completely support what you're doing. Thank you very much.